Hi, I'm Dr. Eli Whitney at the Heart and Vascular Institute of Texas. I'm going to talk about edema, or swelling in the lower extremities. There are 7 basic causes of edema: heart problems, liver problems, kidney problems, blood protein problems, lymphatic system problems, venous problems, and sometimes medications. Far and away, the most common cause is venous insufficiency. Simple blood and urine tests can diagnose the common liver, kidney, and blood protein problems which cause edema. An echocardiogram can diagnose over 99% of the heart problems that lead to edema. Lymphatic problems causing edema are extremely uncommon in the United States, but very common in Africa where certain parasites are present. Some women with a mastectomy or breast removed to treat breast cancer have had the lymph nodes removed from the armpit. If the surgeon removed enough lymph nodes, edema or swelling will occur in that arm. Unless you have had major surgery to remove the lymph nodes in the upper part of your legs or arms, and your echocardiogram, blood, and urine tests are unremarkable, the likely cause of your swelling is venous insufficiency. What is venous insufficiency? As you know, oxygen-rich blood is pumped to the lower extremities through arteries. The oxygen is extracted and the low oxygen blood is sent back to the heart through the veins. Within the veins are small valves which only allow blood to flow towards the heart. The purpose of the valves is to prevent the back leaking of blood toward the ground whenever a person stands or sits. This keeps the pressure low in the entire length of the veins, even when a person is standing up. This is my forearm with the tourniquet preventing the blood from returning to my heart. You can see these small bulges in the veins of my forearm. These little bulges are where a valve is located. Unfortunately, when a person gets older, these valves begin to leak. The leaking causes the pressure to build up in the veins closer to the floor. This higher pressure is passed on to the small veins feeding the larger veins. This causes these veins to enlarge, producing spider veins. This increased pressure is further passed on to even smaller veins, leading to fluid loss and swelling or edema. The spider veins in edema can cause pain if severe enough, and when bad enough, the swelling can lead to significant infections. There are several treatments for venous insufficiency. When the edema is mild and venous insufficiency is not that severe, diuretics or water pills can help the swelling. Diuretics, however, can lower blood pressure and make some people weak. They can also affect the kidneys and potassium levels. Another treatment is for a person to lie down 2 or 3 times per day with the legs elevated. The excess fluid in the legs will return to the heart, where it will be pumped to the kidneys for removal from the body. A lot of people who have to get up at night to go to the bathroom do so to get rid of this excess fluid which has accumulated during the day. The most effective treatment for this form of venous insufficiency is to wear compression stockings, or special stockings which are individually fitted to a person's leg and are worn throughout the day. These stockings are very firm and will physically prevent the water from accumulating during the day. The advantage of compression stockings is that they are effective and there are no side effects on blood pressure, the kidneys, or potassium levels. Another cause of venous insufficiency is when blood clots form in the veins, blocking the flow of blood back to the heart. This can easily be detected in most cases by a simple ultrasound test of the veins in the legs. Blood clots in the veins are best treated by thinning the blood with a medication called warfarin, also known as Coumadin. When a patient has had a coronary artery bypass operation, the surgeon frequently removes veins from the legs to use as bypass vessels for the heart. This frequently causes venous insufficiency and chronic edema in the leg from which the veins were taken. Certain high blood pressure medications, known as calcium channel blockers, and certain diabetes medications called TZDs can cause edema. Edema can often be improved by using different medications to treat high blood pressure or diabetes. If you have peripheral edema or swelling, it is very easily evaluated by a physical examination, simple blood and urine testing, an echocardiogram, and checking your medications. If this evaluation is unremarkable, then it is very likely that you have venous insufficiency. If only one leg is affected, or one leg is affected to a much greater extent than the other, the problem may be due to a blood clot, and a venous ultrasound should be performed to see if Coumadin or warfarin is needed. When both legs are affected, it is likely due to leaky valves in the veins. I hope this educational program has helped you understand peripheral edema, what causes it, and how we treat it. I'm Dr. Eli Whitney at the Heart and Vascular Institute of Texas.